by local health authorities. Like when it comes to individual cases or even, possible contact at events, I know we had like a case in Sun Peaks here over the weekend where the community felt the need to put that info out that there was a positive case in Sun Peaks. Is that something that should be coming from communities, or is that something that the health authorities should be letting us know about?
Yeah, so the health authorities will let you know when there's a risk to the public that we can't identify. The health authorities will let you know when there's a risk to the public that we can't. The health authorities will let you know when there's a risk to the public. So the health authorities will let you know when there's a risk to the public. That even though the risk was low, that if they develop symptoms, it might be related to that. We've done that for the dental conference. We've done that for some community exposures where we're not able to identify everybody who was there. The Sun Peaks one, I understand it was that individual who felt that he wanted to go public with his diagnosis, and the fact that he had warned a lot of people about this and had connected individually with people. So I think that's perfectly valid. If individuals want to talk publicly about their own experience, that's up to them. But for us, it's in public health, it's ensuring that we put any risk out there in the public that people need to know about, and then we protect as much as possible people's privacy. So it's finding that balance.
Great, thank you. And our next question is Moira Warburton from Reuters. Go ahead, Moira. Okay, we'll move on to Marcella Bernardo from News 1130.
Hi, Dr. Henry. I was hoping to ask you about the downtown east side because we now have information that someone who has COVID-19 is now in that neighborhood. So could someone please clarify what's being done to keep others in that area safe, namely frontline health workers and volunteers interacting with these people daily?
Yeah, so my concern about the downtown east side is the workers, of course, but also the people who are living in those in the areas in the downtown east side in particular are people who often have other underlying health conditions. So our work with Vancouver Coastal, with the City of Vancouver, the strategies that we have in place with a number of the agencies. So there is a very specific working group that has developed plans for how we would support and manage issues in the downtown east side. And really it is protection of the people who are living there who may be more vulnerable to having severe illness or from COVID-19 that we're focusing on. There are plans in place for how to help people isolate should they become ill. There's places that are available to house people and care for them should they become ill.
Next question comes from Jane Side from the North Shore News.
Hi, Dr. Henry. I'm hoping that you can clarify a little bit around this possible death connected to the dental conference. You've said that the coroner is investigating. I haven't heard that in terms of any of the other deaths that you have announced so far in relation to coronavirus. So I'm just wondering, what makes this particular death different in terms of how you're investigating or treating that, as opposed to some of the others that have been previously announced?
Well, I think that's exactly the point. The coroner is investigating a sudden, unexpected death in the community. We don't know if it was related to coronavirus or not, and that is what that is why the coroner is investigating this. So I have not said that it is a COVID-19 related death. We need to understand the circumstances of the death, and that's the role of the coroner.
Next question, Keith Baldry from Global News. Okay, next, David Molko, CTV.
Hi there, Dr. Henry, just following up on the North Shore dentist as well. You said yesterday your advice to patients, people can be reassured that if you saw your dentist and they were fine and there was nothing wrong with them and they had no symptoms at that time, that you're not at risk. Those were your words yesterday, and my question to you is, you sounded pretty confident. How can you be so sure given some people never show symptoms at all? You sounded pretty confident.
Yes,
How
and
can you
we
be
also
so sure
know
given
that some people who never show symptoms, their chances of passing it on to others. And we also know that some people who never show symptoms, their chances of passing it on to others. So the whole question of asymptomatic transmission. We also know that the people that we have been in contact with who had symptoms, the people that they had contact with when they were at risk are either have been or are being contacted by public health. So if you have not been contacted by public health, then you're not somebody who saw that person when they were symptomatic. We also know that the most transmission happens with close contact on a regular basis. So often it is staff and people working in the environment that are more at risk as well. So it is a challenge. There's obviously it's not zero risk, but if you were in the office days before this person developed symptoms, then we don't have any evidence that shows that you're at risk for this.
Next, Nick Johansson, Castanet. Go ahead, Nick.
Hi, Dr. Henry. I was just looking to get some clarity on the criteria the ministry is using for disclosing locations where outbreaks of COVID has occurred, and would a place like a subsidized senior housing development fall under that criteria?
Yeah, it's criteria that are used by the health authorities, by public health, where we declare an outbreak. So if it is in a setting like a shelter, for example, a housing community, something like that, where we have outbreak measures that are taking place, then we will declare it an outbreak. We actually have a protocol that we've been using for many years around long-term care in particular, where those are posted, and around acute care facilities. So you will have seen them on health authority website over the years of influenza-like illness or gastrointestinal, so stomach illness outbreaks. We've had outbreaks of other diseases as well, and that there's a transparent process for posting when those are happening. So we're using the same criteria for this as well.
Next question comes from Megan Tricato at Global. Go ahead.
Hi, we've had a notification here at a fairly large Vernon High School that students and staff might have been exposed. The notification went out in the last couple of days, and the isolation period was meant to end today. That would be a notification here at a fairly large. If you have any thoughts on what this case, with people being notified right at the end of this proposed or required isolation period, what this says about our ability to notify people about potential exposures and to contain it, and whether you know if this case at Clarence Fulton High School is going to be treated as a potential cluster, and if other people with symptoms are going to be tested.
So I guess there's a couple of questions in there. So I'm not aware of the exact circumstances of that exposure, and it would depend on what the notification was about. So there are different levels of risk when somebody has been exposed. When we find somebody who has this disease and we find their close contacts, we do that contact tracing, and we find anybody who is around them and who we know have the highest risk, and we isolate them during the incubation period. Sometimes, and this has happened in a number of occasions where somebody has traveled, we've had people come back from a cruise, for example, and we didn't realize that they had been exposed till quite late in the incubation period, and so in their contacts in incubation period. So they might have been sick for many days, walking around doing things and having close contacts. So the best that we can do is advise people to self-monitor for that period of time, and if they have developed symptoms during that period of time, to connect with us. So all of these ones where somebody was advised that you needed to monitor for a period of time means that we've done a cluster investigation of that individual and realized that others may have been at risk. But the risk is not the same for everybody. It depends on the type of contact you might have had. So even if we say, for example, here in Victoria, if you had been at this establishment on this day, you might be at risk. But we can determine when we talk to the individual whether they were actually anywhere near the person or not. So we may not put out all the details of the investigation that we have in each case, and that allows us to help individualize people's risks when we connect with them. The dental conference is a good one. We didn't recognize that there were a number of people who became sick related to that conference until we were at, I think, day 7, day 8, or maybe it was even day 10. So we were asking people to self-isolate for the following 5 or 6 days, and more cases. So it's a little bit of a combination of isolating those who had not yet become sick and case finding, or finding the people that were out there that were sick, and then trying to stop their next generation of contacts. So it is a challenging thing. It's incredibly challenging, and we talk about, that's where testing helps us. That's where contact tracing, basic public health work is really, really important. And we look at what they've done in Hong Kong, in Taiwan, in Singapore. That's the basis of it. We have our firewall that we're trying to have with everybody keeping their distance, and then we're doing the contact tracing of individuals within that firewall to try and put out the sparks and the flames as they arise. And it's challenging because we don't always find people in time, and that means that others have been exposed, and so we're now catching up to the next generation. But that's how we do this, and over time we'll be able to, we don't have as many people coming in from other countries, so that helps take those sparks away, and we're now being able to focus on protecting the healthcare system and trying to find those sparks in the community as well.
Cassidy Olivier, Vancouver Sun.
Oh, hi, Doctor. Just a quick question on the hospitalization intensive care numbers. They're slowly creeping up over the last week. Just curious on how we're supposed to interpret these numbers and what they say about how the virus is spreading, and what happens if we keep on this trajectory. And also just curious about an age breakdown of these specific groups that are being noted in here.
Right. So the age breakdown, I presented that on the weekend, and it is up on the BC CDC website on a daily basis. For the most part, we have sort of two groups of people. Most of the people who are hospitalized and in intensive care are older or have underlying medical conditions, but we also have a group of healthcare workers mostly who are younger, in their 30s and 40s, who have very mild illness. So we have a bit of a difference in those. And that is reflected in the data. I will present some more of that when we talk about the modeling and why we're looking at this. Obviously, it's people in hospital and people in ICU that we're watching very, very carefully, because those are hard numbers. In the community, as we talk about, we're focusing our strategy, our testing strategy right now. Present some more of that when we talk about the modeling and why we're looking at this. Obviously, it's people in hospital and people in ICU that we're watching very, very carefully, because those are hard numbers. In the community, as we talk about, we're focusing our strategy, our testing strategy right now. Present some more of that when we talk about the modeling and why we're looking at this. Obviously, it's people in hospital and people in ICU that we're watching very, very carefully, because those are hard numbers. In the community, as we talk about, we're focusing our strategy, our testing strategy right now. Present some more of that when we talk about very carefully. It's heartening to me, though, that we're not seeing dramatic increases and doubling in a day or 2 days or 3 days of the hospitalized cases. It is gradually increasing, though, and we're watching, because those are hard numbers. In the community, as we talk about, we're focusing our strategy, our testing strategy. Some more of that when we talk about carefully. It's heartening to me, though, that we're not seeing dramatic increases and doubling in a day or 2 days or 3 days.
Construction sites or closer guidance around construction sites. And on another sort of similar issue you've dealt with, on the downtown east side, there's also been a number of complaints around social distancing issues, and I know Marcella asked about this, but more specifically, does more need to be done on the downtown east side to move people out of that community to ensure that they are forced to socially distance.
Yeah, so, I don't know the circumstances of somebody at a construction site, whether that person was exposed at work or exposed in their home environment, and that is what the public health investigation will look into. I absolutely think there needs to be measures at all of the workplaces that are continuing to function, to keep us going, all of the essential services, some of the construction work, to make sure that we have the best measures in place to protect everybody on that site. And I know WorkSafe is working on those, that we have measures that have been enacted in many of those, or most of those is what the public health investigation will look into. I absolutely think there needs to be measures at all of the workplaces that are continuing ways of mitigating risk in those sites. In terms of the downtown east side, again, like here in Victoria, like in other communities, this is the home for many people. So we shouldn't be thinking about forcing investigation will look into. I absolutely think there needs to be measures at all of the workplaces that are continuing ways of mitigating risk in those sites. In terms of the downtown east side, again, like here in Victoria, like in other communities, this is the home for many people. So we population we shouldn't be thinking about forcing investigation will look into. I absolutely think there needs to be measures at all of the workplaces that are continuing ways of mitigating risk in those sites. In terms of the downtown east side, again, like here, ways to give people their own space that's safe and away from others. Population we shouldn't be thinking about forcing investigation will look into. I absolutely think there needs to be measures at all of the workplaces that are continuing ways of mitigating risk in those sites. In terms of the downtown east side, again, like here, ways to give people their own space that's safe and away from others. Population we shouldn't be thinking about forcing investigation. I absolutely think there needs to be measures at how people have done this and what has worked. I think we need to find that sweet spot where we're still able to get food, to get medicines, to carry on the important functions of our days and our lives, but also maintain that distance, that space between people. So it can never be 100% in that not everything can shut down in our society, but we need 100% of people to do their bit, which means making those sacrifices both as an individual, as a family, and as a community. And I've talked about some of the important sacrifices that we make about things that comfort us in a time of stress, like the ceremonies, like the celebrations, the rituals that we have as a community that bring us together. Right now, we all have to take a step back and look at how we can support each other virtually, how we can maintain our connections, our support of our community without having that physical closeness. And we need to do that now. And all of us need to be conscious about that in all of our communities, because it is protecting our own families, our communities, and across British Columbia. So that's where we're talking about 100%. We all need to understand where the risks are and how we can be part of this to keep that firewall up there for us.
Next question is from Keith Baldry. Go ahead, Keith.
Hi, Dr. Henry. I wonder if you could expand on your comments and concerns about the personal protection equipment issue. How acute is a potential shortage? And the minister has talked about, well, he's announced he's vacated 30
British Columbia. So that's where we're talking about 100%. We all need to understand where the risks are and how we can be part of this to keep that firewall up there for us.
Next question is from Keith Baldry. Go ahead, Keith.
Our wicked problem.
Hi, Dr. Henry. I wonder if you could expand on your comments and concerns about the personal protection equipment issue. How acute is a potential shortage? And the minister has talked about, well, he's announced he's vacated 30.
British Columbia. So that's where we're talking about 100%. We all need to understand where the risks are and how we can be part of this to keep that firewall up there for us.
Next question is from Keith Baldry. Go ahead, Keith.
Our wicked problem.
Hi, Dr. Henry. I wonder if you could expand on your comments and concerns about the personal protection equipment issue. How acute is a potential shortage? And the minister has talked about, well, he's announced he's vacated.
British Columbia, so that's where we're talking about 100%. We all need to understand where the risks are and how we can be part of this to keep that firewall up there for us.
Next question is from Keith Baldry. Go ahead, Keith.
Our wicked problem.
Hi, Dr. Henry. I wonder if you could expand on your comments and concerns about the personal protection equipment issue. How acute is a potential shortage? And the minister has talked about, well, he's announced he's vacated.
You're dealing with everybody who has the same thing. So there are things that we will be doing over the coming days, and we can have more details once we've worked it out with the healthcare worker leaders and with our hospital leaders over the next 48 hours. We are also absolutely looking at all aspects of things that we can do to increase our stockpiles of personal protective equipment. Particularly, there's good evidence that you can reuse certain types of equipment if it's been cleaned appropriately, and we're looking at how we can do that. We're also looking at alternate supplies from around the world.
Great. Next question is from Ashley Wadwani from the Black Press. Go ahead, Ashley.
Hi, Dr. Bonnie Henry. Can you elaborate by any chance on the age of specifically the 26 people who are in intensive care right now, as well as the 64 others, or the 64 who are hospitalized?
I could, but I don't have that data with me, but I can certainly bring that tomorrow. There is an epidemic curve that is on the BC CDC website with an age curve as well. The majority of people who are hospitalized are, just doing it from memory, I know all of the deaths have occurred in people who are older than 70. The hospitalizations have been primarily in people who are over I'm just trying to think of it in my mind. I believe it was over 50. There has been one hospitalization in a person under the age of 10. There has most of the ICU cases as well are people who are over 60, but I don't have the exact details, but I can get that for tomorrow.
And our last question comes from Glenn Korstrom from Glacier Media. Go ahead, Glenn.
Hi, Dr. Henry. Can you hear me? Hello?
Yep, we can hear you. Go ahead.
Okay. Ever since the first case at Lynn Valley Care Center, you were aware that many care home staff worked at multiple facilities. And then in the last week, you said that there was a policy that these workers would only work at one facility. And yesterday, you said that you weren't sure if the policy was in effect, but it would by the end of the week. And I'm just wondering what took so long. What were the glitches so that it didn't take effect right away?
Yeah, so it is complex. So it's not a policy, it's an order. So it's a provincial health officer order that looks at the whole long-term care, assisted living, and acute care sectors. And what we will do over the coming days is have a centralized assignment of people so that people work at one facility only. What is the challenge is over the last 20 years, there have been contracts and subcontracts for different types of workers in long-term, particularly in long-term care. So whether it's nurses or care aides or the food service people, the cleaning in those facilities, that has meant that there are many different types of contracts, there are many different types of facilities. Some are owned and operated by the health authority, some are private, and the types of subcontracts they have are myriad and complex. So it's not as simple as saying, okay, everybody, you just need to go to one facility only, because that would have left other facilities potentially with an extreme shortage. So it had to be managed in a centralized way. We have both particularly in the Lower Mainland, as you know, this is where where the facility outbreaks have been most intense. And the medical health officer, Dr. Patty Daly and Dr. Martin Lavoie in Fraser Health and Vancouver Coastal, respectively, they have put orders on the outbreak facilities so that people can only work in that facility once it's identified. So now we need to do that on a broader scale. As you can imagine, with some unionized, some non-unionized, the wage scales are different as well. So we are coming out with a provincial central strategy that provides a consistent approach to all facilities across the province, focusing on the Lower Mainland right now, and that it has been a very complex program. But it is starting. The outbreak facilities themselves are first and have started already, but we will be moving for all facilities within the coming days.
Great, and that's all the time we have for today. Thank you.
Thank you very much.
That, of course, Provincial Health Officer Dr. Bonnie Henry updating us on the COVID-19 situation in BC. She was offering us the latest numbers, 42 new cases, 659 in total in BC. Let's go now to our Keith Baldry for a little bit of analysis. Hi there, Keith. So the takeaway for me here was that, well, a lot of things really, but mostly Dr. Henry was saying it'll still be a few days, maybe a week, before we see if the measures that have been taken actually see a decrease.
Yeah, there's a backlog of testing. She pointed out that we're going back 2 weeks now. People could have got this 2 weeks ago and are just presenting now. So the next week is critical. A couple other takeaways. Her comment that she's a little bit optimistic that the numbers of hospitalizations did not go up substantially like they did yesterday. They went from 33 to 59. Today they only went up 5 to 64. And same with the ICU cases. Not a big jump there. So the other significant thing was her concern about the critical point at the personal protective equipment issue. We've been hearing from frontline staff in various healthcare facilities that they are concerned about potential not having enough equipment if this anticipated wave of hospitalizations occur. Health Minister Adrian Dix has vacated more than 3,800 beds in anticipation of a worst case scenario. And you heard Dr. Henry outline some of the steps they're taking to shore up that equipment, and also sort of trying out different things about, you heard her refer to cohorting patients together so healthcare workers don't have to change masks as often as they would do if they had to go from room to room. So a number of measures there, an indication that that is a problem, so they're taking steps to address it. Other issues coming out, again, concerns about long-term care homes. The numbers there continue to climb, but not by a lot. Her acknowledgement there at the end was quite interesting about the fact that because of measures that were undertaken by the BC Liberal government under Gordon Campbell a number of years ago about healthcare workers, members of the Hospital Employees Union in some cases, that have required workers to work in multiple facilities over time. Some of those problems are now playing themselves out, and some of the infections presumably came from healthcare workers moving between long-term care homes. And then at the end again, when she talked about sort of the demographic makeup of people in hospitals, she disclosed for the first time someone under the age of 10 is in hospital right now with COVID-19, and we didn't know that before.
Yeah, that one was quite surprising to me as well. She said a lot of the hospitalizations, people 50 plus, and the people sort of in ICU, mostly in the 60 plus age range. So interesting to hear her break those down. Of course, she was also talking about large gatherings and just encouraging people not to get together in large gatherings as well.
Yeah. And singling out special attention for religious services and ceremonies, that you've got to do these sort of ceremonial and celebrations through virtual gatherings, not through gathering in a church or a temple. So that's a message to religious leaders. Already we've seen the Archdiocese in Vancouver take the step that last Sunday there was no Sunday Mass, and it's just now going to be a virtual Mass, and then she's expecting other religious organizations jurisdictions to follow suit. But again, no public health order on that yet, but keep in mind, this is she has the ability to enforce these recommendations and turn them into orders if she so thinks it's necessary. But again, the number's not as big today as they were yesterday, and that is a little bit encouraging. But as you pointed out, Jen, it's going to take another week to 10 days whether or not we've actually succeeded in flattening down the curve.
Yeah, absolutely. And unfortunately, there was one additional death.
Yes.
I should mention that. So hopefully all those families getting the support they need through this very difficult time. Thank you so much, Keith, for being here with us and breaking it all down. We look forward to what you have to say on the News Hour tonight as well.
And we'll talk to you tomorrow.
Thanks very much.
Okay.
All right, stay with us. We'll have continued COVID-19 coverage coming back in just a few moments right here on BC One.
BC One, your province's 24-hour news channel.
Whether you're a daily commuter or a new driver, a hockey mom or a soccer dad,